Hi, and welcome to HitMic. I'm Colin Hung, and today I'm joined by my friend Pam Landis, VP of Digital Engagement at Hackensack Meridian Health. Pam, welcome to the program.
Thanks so much, Colin. It's always good to catch up with you and to hear from all the people working in this space.
It is incredible that it has been more than a year and a half since you and I last saw each other at an event. And usually we see each other 2 or 3 times in the year. And I miss seeing you. I saw you on screen, but I haven't seen you in person.
The same thing here. That's been like one of the things is I think not being able to travel and to dealing with what we're dealing with is we've lost out a little bit on the touch points and the learning that we get from each other in person. It's like those small moments. We all can communicate virtually and email and text and Zoom meetings, but sometimes it's those small moments in a hallway or at a coffee shop at a conference where you really get your aha moment. And that, I think we've missed out a lot of that.
I totally miss it. I don't miss the flying, but I miss the whole interaction for sure.
Exactly.
Now, I have to first of all congratulate you on winning the 2021 Medigy HitMic Award for Marketer of the Year in the provider category. So congratulations.
Thank you so much. I was shocked and surprised, but I was really grateful for that. That was so nice.
So what went through your head when you found out you won the award? What does that award, winning that award, mean to you?
You know what? The first thing was that I thought was, I can't wait to tell the team. And not for, oh, look at me, but no, like, team, you did this. I stand on their shoulders. None of this work gets done without them. And I thought, I want them to know that others recognize that the work that they're doing is really, amongst the best. I believe that, and I tell my boss that, and I tell our board that, but the fact that someone, externally said and validated and said, you're doing really good work, keep it up. And I wanted the team to know that and feel the pride in that.
That is, you were well deserving of it. The nomination was phenomenal, listing some of the accomplishments that you did last year. And but maybe for the benefit of those folks who don't know you, can you maybe describe your role at Hackensack Meridian and why the role is so important?
Yeah, I came to this role in a non-traditional route. So I'm not a fully marketing person and I'm not a fully IT person. I've worked in marketing for a long time and in PR, and actually I started off as a journalist, working for Gannett newspapers, but I worked in communications for a long time. And then one day I was working in clinical PR at Johns Hopkins Hospital in Baltimore, and it was 1995, and my boss leaned out from his office, he did this, and he said, we really need to figure out the World Wide Web. And I said, oh, I'll do it. And the reason I volunteered was because in my cubicle was the server for the office. And so when something went wrong, they would be like, oh, Pam, you have to fix that. And I'd get on with our vendor and I'd like do my C prompt and he'd tell me what to do. And invariably he would say, just reboot. And I thought, I've got computer skills now. And I would go, and so I taught myself how to code. And I literally bought HTML for Dummies. And I would go to different websites and view the source code. When I found out, oh, you could view source. And I would copy and paste and put it in. There was a program called Hot Dog that created web pages. And then there was Dreamweaver. And so that's how the journey started. And over the years then, I really got into IT, and I worked for a very long time in IT systems, got a master's in health informatics, but really started to understand the intersection of communications and user experience with technology and how to bring those together. And then also understanding, having appreciation for operations in hospitals and physician practices. So I kind of sit in between all three and try to knit those three groups together to create a good experience for the user.
So when you say user, do you mean both patients and internal staff as well? So
I
it's not
do. So
okay.
my team actually has responsibility, what we call digital engagement. And people are like, well, what is that? Well, it's your website. So it's internal and external. It's for clinicians, team members, patients, and consumers. And those are my audiences. And I have to recraft digital solutions that meet their needs. And so we work on websites and mobile applications and virtual care. We work in customer relationship management and targeted marketing, and all the applications around patient engagement. How do we make things easier for patients to access healthcare?
Wow.
And,
What,
and,
go ahead.
and we have a contact center. We're building out a contact center. Well, it's up and running, and it's centralizing all of that so that it's just one place to call us to get help. There'll be eventually one phone number for all of HMH for patients and consumers, and then one internal phone number for team members to call and say, I need help with, it could be an HR issue, a payroll issue, purchasing, IT help desk, like I need help.
Wow, that's actually really, really interesting. We definitely have heard of others who have consolidated externally facing contact centers, but
Right.
have not heard about too many organizations consolidating an internal one so that if a staff member needed help with anything, they can just call one number and get directed to the right people.
Exactly. So that's our vision, and that's what we're driving toward, because we actually do think they could go to an intranet and you bring together an intranet of everything. So why can't I have a phone center that does the same thing? And they all use the same information. And so no matter where you call from, because at Hackensack Meridian Health, geographically, we run basically the entire corridor of the state along the coast from the north down to the south. The answer you get around your payroll, whether you sit in northern New Jersey or down on a beach in South Jersey, it's the same answer, and you should get the same answer.
Amazing. Is there any other project that stands out for you from the last 12 months? It sounds like this one, it was amazing. Is there anything else that stood out for you?
Yeah, I think that the idea was we had to get, it's a success and a failure. There are things when we look back on our vaccination program.
Okay.
We started, our vaccinations on December 15th and here in New Jersey, and, immediately started with healthcare workers and those at risk. And we stood up really nice, good online scheduling systems. Because if you remember, it's group 1A, group 1B, and group 1C. We had to go through all of that. And so we had scheduling systems, and we ran, so far we've done 620,000 doses here in our network, delivered out in the community amongst 20 sites. We ran a mega site at the Meadowlands, and it just closed on June 24th, which is actually kind of great. We were able to close the site. But as great as that online system was that helped people get in the door and get their vaccinations and make sure that they had everything that they needed, I also think that because everything came at us so fast, we weren't able to set up non-online systems well. And we were not able to set up systems in other language as well. And for me, that's a miss and a learning, so that the next time I'm going to be ready for people who were not, computer savvy. It was tough. It was tough for them to get, whether it was here at HMH or at a Rite Aid or a CVS, it was tough if you were not computer savvy and literate to get access. So we have to make sure in the next round that we actually address those folks. In our rush to get it out, and we were doing the right thing. This was the right thing. Get it out, get it in as many arms as you can, as fast as you can. That was the route we chose, but we're going to prepare systems for that next time. And I think that will be better. What we did do was there was a Facebook group in New Jersey that started of volunteers who people would go on Facebook and say, my 85-year-old mother needs help with an appointment in Bergen County. And these volunteers would stay up all night waiting for drops at CVS or Rite Aid or here at HMA. And they would go on and they would book those appointments for these folks. There were 140,000 members in this group. And these volunteers were amazing. And we actually brought them in to HMH and gave them awards because that was the great part, how the public and HMH came together and worked together and said, we'll follow the rules. We're not going to encourage line jumping, but we're going to help people. And we worked really closely with them, making sure that all those people had the right information, the latest information to be able to get access for the people they were scheduling for. They became our schedulers. They became our de facto call center. And I cannot tell you how moving it was to meet some of these people. Like, just, stay-at-home moms, retired folks, librarians. They just raised their hand and said, I'll help. And they would stay up until 1, 2 o'clock in the morning waiting for new appointments to drop, to schedule it for people that they had never met. It was really, it was the most inspiring thing that came through for me.
Wow, what a great story. And you're right. It's amazing how the community can come together like that in a time of crisis to help out.
Yes. 2020 was a horrible, horrible year. Besides a pandemic, the racial strife, the election strife. But then there was a group of people in New Jersey that just said, I'm going to help my neighbor, and I don't even know who my neighbor is. And it was really the most beautiful thing I ever saw.
Now, I have to bring this up. You and I have a mutual friend, and you've worked with her. And so I wanted just to ask, I'm talking about Grace Cordovano, of course.
Oh my gosh, yeah.
Great patient advocate based in New Jersey.
Uh-huh.
How have you worked with patient advocates and people like Grace in your role at HMH?
So I'm going to tell you a great story about Grace. When I moved to New Jersey, and I follow her on Twitter, and I watched what she was posting about some stuff on my chart. I'm like, wow, she's got some good insight. And so I started to reach out to her, and I've learned a lot from her. She was one of the early people that was able to become vaccinated at our mega site at the Meadowlands. And she came back and she tweeted about her experience. And there were a few things that she tweeted about. That she said, here's how you can make it better. And I read that and I was like, oh, she's absolutely right. I called her up and I said, okay, Grace, take me through everything. Tell me what your experience was like. And she took me through it and took me through the screens. And I'm like, oh, she's right. The system worked. Technically it worked, but she helped make it better for us. She said, Pam, make this field do, I expected this, and it did this instead. And I'm like, easy fix. And so basically what I do is I count on these patient advocates to give us feedback. And I want it to be hypercritical. Like somebody said to me, oh, well, we did a test, we did a user acceptance test and we found no bugs. And I said, then you didn't do a good test. And, but Grace and others like her, Stacy Kurt, other people, I follow them and listen to them because they are really a voice of a million people behind them. And while they have an appreciation for healthcare, they use their voice to keep us accountable, and we have to start listening to them.
Wow, amazing. Amazing.
Yeah.
So before we got on camera, Pam, we were talking about some of the challenges that may be coming down the pipe. So I'm interested in asking you, what are some of the external forces that you're seeing that we're going to run into, or what do you see some of the challenges coming at you?
Yeah, there's a lot. We've talked about virtual care and hospitals at home, and my personal philosophy is we're going to be successful when we stop building hospitals and start closing them, when we can keep people healthy and at home. really success is, I'm a Star Trek fan. Success is that you don't need a hospital, that somebody comes in with a tricorder and fixes you all up. I'm waiting for that day. But I really do believe that our obligation is to keeping our communities healthy and keeping them out of a hospital. So we need to quickly pivot to how we're going to be doing that. And some health systems around the country have been doing some of that work. Atrium Health did that successfully during the pandemic. Other health systems I know have done that. I think that that's one area that we have to go add some velocity around that one. The other area is around primary care. We've talked about the Minute Clinics
Mhm.
and Walgreens and Walmart and Amazon Care. I am telling everybody here at HMA, if you don't think Amazon or Walmart, with all their fits and starts around this, that they aren't learning and figuring it out, they're going to figure it out. And they will figure it out fast, and they will figure it out with a lot of money. So we need to make sure that we adopt a much more consumer-centric approach to primary care. So for instance, when we go out and talk to patients, and I talk to a lot of patients, now that when in New Jersey and things are, we're over 70% vaccinated, you go out and talk to a lot of people now. Convenience trumps everything.
Okay.
Convenience around primary care, convenience trumps everything. They want to be seen now when it's convenient for them. They don't want to wait. They don't want to be told that. And I think that that is something that we have to be ready for and listen to. Those are the things that worry me, but also the Gen Z, Gen Xers, as they come through and they start to age and need healthcare, they are not brand loyal. They are loyal to convenience and their time. They value their time more than they value anything else. And so we have to be able to understand that and meet that need.
I love that. That very well put.
Thanks.
And you're so right. We John Lynn and I talk about Walmart and Amazon all the time, and yes, they have gone through a lot of fits and starts. They haven't got it quite right yet. Some would say that Walmart's pretty confused at the moment on their approach, but yes, they will figure it out because they have the resources, the mindset to do it.
Yeah. And I think that the other area that I think that we all need to in the healthcare marketing space is to be hyper aware around the legislation that's being discussed and the rules and regulations and the court cases around social media and use of social media, particularly Facebook,
Okay.
and how Facebook is used and how groups are used and the data that's collected. We have an obligation to our patients and to the communities to be good stewards of the information that we put out and how we put it out and how we collect the data and how we use and target them. We have to be very, very aware of that and make sure that we're responding to that. And also if you look at what Apple is saying, Apple is basically saying privacy is an element of our brand. Our walled garden is something that we will protect. And if you listen to what Tim Cook talks about, he talks about privacy a lot. And the changes that are coming with iOS 15, that's really going to change the way we do healthcare marketing through email campaigns. So we have to be not only listening to what the competitor down the street's doing, but we have to be really aware of what these platforms in Apple and the App Store, their privacy rules, what social media is doing, and the data that we're collecting around that. We have to get really smart and sophisticated and be cautious about how we approach this.
No more read receipts and no more
No more
AB
read
subject
receipts.
line testing
Yeah.
in iOS 15.
I sent the information over to my CRM team, and the one woman who works on it, and she's really quite a rising star. And you guys are going to get to know some of these people on my team. I've got some rising stars, and her name's Kylie Stanger. And I sent it to her, and she's like, "Oh, no read receipts? Bring it. I'll figure this out." And I was like, "Yes, that's exactly right. How do I get that information out to them and make sure that it's, that it's useful for our communities and actionable, and that, we understand what the value is."
So, Pam, let me ask you this. What keeps you going? What keeps you energized to do your work?
Um, I think I got into healthcare. I worked in Washington, D.C. for a national lobbying firm that worked on family medical leave and the first healthcare, and this I'll tell you, 1993, when the first healthcare failed under Hillary, the 1,100-page healthcare reform document. And I realized that Washington was a gutless, soulless town, and I hated it, but I loved healthcare. And after having a pretty significant health scare for myself in 1988, I realized how hard healthcare was. And here I am working in healthcare, and my family comes to me like, I'm like, "Oh, I'm not a clinician." And they're like, "Can you help us maneuver through the healthcare system?" And what gets me going is if I can make it easier so that my mother can stop calling me and saying, "What should I do? How do I get an appointment?" If everybody knows how to get in and can get in well and be cared for well and navigate the system, well, that's what matters to me. The fact that people like Grace Cordovano has to do care navigation in her community in northern New Jersey, to me, is a failure on us. And I want to say that I'm going to make it so easy that Grace is just going to have regular relationships with the Polish community in northern New Jersey, and she's not going to have to be everybody's care navigator. That's what keeps me going.
I love it. I love it. So, Pam, we're getting to the end of our time here on this episode, but let me ask you this last question. What piece of advice would you give to other healthcare marketers in terms of advancing their careers and their progression? Because you've had quite the journey from, being in Washington as working for a lobby group, IT, working in marketing and PR. You've kind of done and seen a lot. What advice would you give someone?
I would say, actually, raise your hand and volunteer. You might not be the subject matter expert, but you can become that subject matter expert. And I think that if you stay true to your own self and your principles, a lot of people will say, "Oh, find your passion." But I would say, find the problem you want to solve and get involved in that. And I think that becomes your passion, solving the problems. And that's the kind of advice that I give to people. Know that you're enough. You're enough right now. You are enough. And that you can learn this, and that you can ask questions, raise your hand. When that boss leaned out and said, "We need to figure out the World Wide Web," here I was, a young, 20-something young married mom with a little one at home. And I said, "I'll do it." I had no business saying I'll do it, but I had every business because, I need to help. Somebody has asked for help and I need help.
Awesome. Well, Pam, thank you so much for everything you shared today. I love the
Thank you.
stories. Really appreciate it. Congratulations again on winning the award for the 2021 Marketer of the Year. Well deserved.
All right.
I really appreciate it.
All right. Thank you.
This has been Colin Hung with HitMic. Thanks for listening.